Hello, and welcome again to another episode on CYC MD. In this series, we are exploring different specialties and speaking with different professionals in regards to their focused area of practice. Many of us have experienced problems or even saw a doctor in regards to issues or problems with our nose, ears, or throat. With me today, I have Dr. Heidi Marzouk. Welcome, doctor.
Thank you.
Nice to have you. Who will be answering many of our questions in regards to those specific topics of ears, nose, and throat.
Thank you for having me.
You're welcome. Pleasure to have you.
Thanks. So
if we could just start off by just getting to know you a little bit. How long did you have to study, and where do you work?
So I'm a native New Yorker. I studied a Bachelor of Science as well as my med school degree, first at NYIT in Long Island and then at SUNY Downstate Medical Center in Brooklyn. I graduated in 2006 from medical school and then continued my training also at the SUNY Downstate Medical Center in otolaryngology or ENT. I completed that, and now I'm part of the North Shore Long Island Jewish healthcare system. And my office is in Great Neck, New York, and I have an affiliation with Hofstra Medical School.
Oh, nice. So why nose, ears, and throat as a profession?
So I started med school thinking I was going to be a pediatrician because I like to work with kids. But then once I started studying, I realized that I like to work with my hands a lot. And so I started to think about something surgical. I really liked the head and neck area, and I felt like ENT gave me a lot of variety. I still get to work with kids, I get to work with adults, I get to work on all different kinds of disease processes, and I still get to operate and do surgery. So it gave me a good balance of the things I liked, and it gave me a lifestyle conducive to having a strong family life, which was really important for me.
Wow. So on the other end, so I hear why you enjoy it.
Right.
I don't want to ask you what don't you like. I want to ask you what do you feel is most challenging in regards to your profession. We all know that the road to becoming a doctor is long, and even after you graduate and even while you're still working, you're still taking exams. Right. So what would you say is most challenging about your profession?
There's a lot that's challenging. Like you said, it's a very rigorous route. The training aspect is really intense, but once you finish, it's definitely doable, and the lifestyle's pretty good. But at the same time, day to day, you have a lot of challenges because you are dealing with every single type of person, the very young, the very old, the nervous mom, the concerned person you have to tell they have cancer. Yeah. You're dealing with all different cultures, all different education backgrounds, and you really have to adapt to all of that, and that's extremely challenging.
Oh, but I mean, you have a pretty great job with, you're saying like a 9 to 5 and Monday to Friday. You don't really find that
as a choice for myself. Not everybody gets gets to do
That's
that, but I chose that for myself. But again, adapting to all the different people is not easy. And ENT in and of itself is a very narrow focus. So it's very hard to keep up with the rest of the body when you're focusing on a specific area. And you're also a very small population. So when you come to advocacy, whether it be in the hospital, with the government, with the insurance companies, it's not that easy to be part of such a small group of people.
Right. Wow. So let's shift gears and focus on the ears.
Sure.
Many people always ask the question, how do I keep my ears clean? We all know that there's all this wax buildup, but how can I just keep it clean?
So ideally, your ears are self-cleaning, almost like an oven. Your body naturally produces wax, and it actually does have a purpose. It's actually does help fight bacteria. It helps protect the skin of the ear. And ideally, whatever's too much will come out. When it's not ideal and it builds up in your ear, usually it has to be enough to either cause you a symptom or to prevent a doctor from examining you. That's when we know it's too much. And there are different ways to keep your ears clean. Q-tipping should not be one of them.
Oh, no.
I know, everybody gets upset when I say that. But basically, there are things you could use, like with an eyedropper, putting a little bit of mineral oil or even hydrogen peroxide can help the wax to soften and come out on its own. There are some homemade kits that you can use. But the disclaimer is, if you know you have a hole in your eardrum, or you have a tube in your ear, or you're diabetic, cleaning with those things can be painful and or dangerous. So that's when you kind of should go to the doctor for it. But, you know, you can use those things, and if they don't work, then you can always come to a doctor or a specialist to have a cleaning done.
So, I mean, I've heard the term swimmer's ear. What exactly is a swimmer's ear?
Sure. Swimmer's ear, the medical term for it is otitis externa, and it's basically an irritation or an infection of the external ear canal. It usually starts off with a little bit of itching in the ear, some clogging, and then it progresses to have some pain, and you can even have some discharge from the ear with it. It's usually easily treatable with antibiotic drops given by your physician, but you also have to have a cleaning to make sure that the medicine can get in deep enough to be effective. The times when we worry about swimmer's ear is, again, in the frail, immune suppressed, or in diabetics.
What are symptoms? How do I know that I have the swimmer's ear?
Again, usually it starts off with some ear itching and feeling of clogging, and then you can progress to have pain or discharge from the ear.
Is it really related to like swimming?
Yes, it can be. Usually the water exposure can instigate it, and especially because bacteria like the wet environment in the ear, and it can be related to swimming, especially in pools rather than ocean swimming, but both can cause it.
So swimmers, be on the lookout. So I know people always complain sometimes of ringing in the ear. What are reasons that cause these ringing?
Many, some of which are treatable, some of which are not. Usually we separate ringing in the ear into two big categories, which is it sounding like a pulse and it not sounding like a pulse. Most people, it doesn't sound like their pulse. And even wax can cause it. Having fluid in your ear or a cold can cause the ringing, and that's usually temporary. And then sometimes if you have forms of sensory neural hearing loss or more permanent hearing loss, you can get the ringing associated with it. The latter is one which is not really curable. There are certain things we can do to help it along, certain vitamins, certain training techniques to help train the brain to kind of drown it out is the most we can do. But for the other forms like wax or fluid and things like that, sometimes we are able to get rid of the ringing.
So I know now we live in an era where cell phones, of course, are the new thing, and iPods and people having headphones. You know, it's constant. You just walk out in the street, you see people on their cell phones, you see people having their headphones, listening to music. How much would we say is enough to cause like harm to a person's ear, or does it even cause harm to somebody's ear? I know people sleep sometimes with their talking on the phone, or people sleep listening with the headphones, listening to the iPods. How much damage can that cause, or when exactly do we say?
So there's two factors that we look into. One is the volume and the duration, okay? Listening to soft sound on a regular basis is not damaging, okay? However, when we get to higher volumes and prolonged exposure, even in your youth, it can make you prone to noise-induced sensory neural hearing loss, and that's not safe. And of course, when you're using the buds and it's really all of the sound is getting directly put into the ear, it's not diffusing out through mesh or a headphone or things like that, it can be dangerous.
So of course volume is a big thing.
Both the volume and the duration of that high volume.
Right.
So sometimes if you hear a gunshot right next to your ear, that's an incredibly high volume at a really short duration. That can cause damage.
Right.
Or if you're hearing something very loud like construction work or something like that for 8 hours a day, every day, that's a prolonged exposure as well. So those are things to watch out for.
So what advice do you have for parents as to how often they should take their child to see, maybe, get their ears checked?
So, the regular pediatrician is constantly looking in a kid's ear when they're coming. Hearing screenings in many states and many places is now a routine when the kids are born. And it really depends on where the kid is in life. So for newborns, If this pregnancy was complicated by any infection or alcohol use, you have to be on very high lookout to screen for hearing loss. For a baby who's been in the neonatal ICU for more than 5 days, or was a yellow baby that required a blood transfusion, or if the baby has some facial features that are not normal, or other medical problems, neurological problems, again, you want to be on a heavy lookout for hearing loss. If the babies are getting recurrent infections, that's another way, another reason to screen for hearing. Once the baby's a little bit more functional, supposed to start to babble or respond to loud sounds, things like that, if they're not doing the things they should be doing in your mind, that's a time to screen the hearing and have the ears checked. So turning in the direction of sound, getting startled, and then as they get older, babbling words, things like that, turning when mom calls. Those are things to look at in terms of screening the hearing more frequently.
As far as adults and for seniors are concerned, how often do you think they should go for?
So that's a little bit easy and tricky at the same time, because you're able to notice yourself when you're having a problem. A lot of times it starts out just in a noisy restaurant or with background noise while the TV is on. You can start to have trouble. If you feel in any way you're functionally not where you used to be, you should have a screening done. If people tell you, you're not where you used to be, are you having trouble hearing me, socially it's starting to affect you, that's a time to have a screening done. If you're having any symptoms in your ear other than hearing loss, like ringing, like dizziness, chronic pain, that's also an indicator that you might want to have your hearing checked.
Thank you, Dr. Heidi.
No problem.
We will return for a short break and be right back with more questions and answers on nose and throat. We are back with Dr. Heidi Marzouk, ENT specialist at North Shore LIJ. Previously, we talked about how to clean your ear and different things that are associated and different issues that can come up associated with ears. Now we are shifting gears to the topic of a nose. So our nose, welcome back, Dr. Heidi.
Thank you.
So I know many of the parents always try to act like Dr. Parent, and when their child's nose bleed, and sometimes you hear them say, tilt your head back, tilt your head forward, pinch your nose. I want to know, what is the best way to control someone's nosebleed?
Sure. Nosebleeding is very common, especially in children. The most common cause is nose picking, but there are so many other things that can cause it. Just having a cold itself, allergies, a dry nose, and sometimes more concerning things like bleeding disorders or tumors can cause nosebleed. And the question is what to do when you have one. The first thing is stay calm. Okay. Getting anxious, or if your child sees you anxious, can increase the rate of bleeding because of the anxiety. The next thing you want to do is just gently blow out any clots that are in the nose, not vigorously, okay, just gently. If you do have some spray, nasal decongestant at home, I recommend you spray a little into your nose. And then at the soft part of your nose, which is right here, you're going to pinch, actually, and look down while seated up. You want to keep the head above the heart, grab the soft part, and look down. And you're going to hold that pressure for at least 5 minutes, okay, 5 to 10 minutes.
So head down.
Yes. If the bleeding doesn't stop at that point, you can try again for another few minutes. And if it's really not stopping or slowing down, you have to seek medical attention. Okay. But a lot of times just that gentle pressure will take care of it.
And what would you say would be like the average time like it would take for a nose to stop the bleeding if you're in that position?
Sure. Like I said, usually you're going to give it at least 10 to 15 minutes. 10 to 15. And once it's beyond that time, then you should seek medical attention.
Okay. So, I mean, I'm a pharmacist, and sometimes I have people that come and they ask me, my child's nose keeps running. What do I do? How do I stop this? Or what is the cause of all this, like, running in my child's nose?
That has a lot of causes, but the most common, I would say, if the kid has either chronic infection, allergies, or if the adenoids are large, all of those things can cause blockage of the nose and frequent running of the nose. And it's best to kind of have it evaluated by either your pediatrician first or the specialist next to kind of get to the root cause, because a lot of times once you treat the cause, the running will stop.
So sometimes when we get sick, whether we have the cold or the flu or we have a stuffed nose, we lose our sense of smell. So what causes that?
So that's something that we call hyposmia, or a decrease in the sense of smell. The most common cause of that is blockage, whether it be from a cold or a polyp or otherwise. Basically, the nerves or the nerve receptors that pick up on smell are really high up in the nasal cavity. So anytime you're blocking the root of those particles to the receptors, you're going to have a lack of smell. And by nature, you probably will have a little bit of a lack of taste also. And once you clear up the blockage, the cold goes away or the polyps are removed, etc., the smell can come back. There are rare instances where smell doesn't come back, but again, those are rare.
And what causes sinusitis?
Okay, so sinusitis is a broad term for inflammation within the sinus cavities, which are air pockets within the face and head. And once you get a bacterial infection of those pockets, you get sinusitis. There can be acute sinusitis, which means it's a rapid onset of symptoms. And once those symptoms are around for more than 3 months, we put it in the category of chronic sinusitis. And it's hard to know the difference sometimes if you have a cold, a sinus infection, or just allergies. The things that I really look for are facial pain, colored secretions, fever. Sometimes you can have bad breath, and also the duration of symptoms. If you're having symptoms for more than 3 months, chances are you don't have a cold. You probably either have allergies or a chronic sinus infection, and those are the ways I differentiate it. And we have a chart up kind of giving you a guide on how to differentiate the symptoms and when you should seek some medical attention for it. Because it's usually easily treatable with a regimen of antibiotics and other adjuvant therapies.
So what is a postnasal drip?
A lot of times when we have secretions in the nose, we blow our nose, it comes up the front, and we have a runny nose. Sometimes when those secretions are made in the nose, instead of coming out of the front, it goes down the back of the throat. And it can give us a sensation of drippage, cough, a lump in the throat, and sometimes even pain or irritation. And that's what we call postnasal drip.
And how would I know I have allergies? Many times, people always ask the question, some reaction develops, is this an allergy? And they start getting scared.
Sure.
How do I know if it's a true allergy?
Right. So allergies is basically the immune system overreacting to something that it shouldn't, something that should be normal in our environment that we should tolerate. The most common environmental allergens that I'll see in my office are to molds, plant pollens, dust mites, or animals. And a lot of times the symptoms, at least in the ENT part, are itchy eyes, a watery nose with congestion, itchy ears, postnasal drip, and sneezing. Those are, telltale signs of allergies, although they're not the only ones. And again, they'll tend to be prolonged, and sometimes, especially if the allergies or the symptoms are seasonal, you want to correct an allergy at that point. More severe signs of allergies, such as tongue swelling, lip swelling, are a much greater cause for concern, and that should seek immediate medical attention.
I want to now shift gears to the throat part. I mean, I never had to have it removed, but I don't know. I know many times people say they have to get their tonsils removed. And what is the reason behind it that people need to have their tonsils removed?
Sure. The tonsils, there are several reasons to remove them, and sometimes you can get away without it. In the pediatric population, the two most common reasons they're removed are for what we call sleep apnea, or sleep disordered breathing, which is when a child snores, and the snoring can sometimes get so severe that they have gasping episodes during sleep and they actually stop breathing. Long term, that can affect a child's growth, development, and health because they're constantly not sleeping well.
Right.
So if a child is snoring and needs to be evaluated for sleep apnea, either by history or formal studies, we make the determination of if they need their tonsils out, because 96% of the time, once you take care of the blockage that's occurring from the tonsils and adenoids, the kid does fine. Another reason is frequent infection. If their kids are getting more than a certain amount of strep infections or throat infections, we consider removing the tonsils in order to eliminate the problem of frequent infections. For adults, again, the frequent infections is a more common reason to remove the tonsils, but adults can also have tonsils removed with other aspects of a procedure in order to help sleep apnea or snoring.
So I believe this problem also happens a lot with singers, I would say. What causes someone's voice to become hoarse?
Sure. Hoarseness can happen from a lot of reasons. Sometimes it's just temporary for a few days when you have a cold or laryngitis, and that's nothing to be very concerned about. But sometimes from voice abuse, reflux, benign tumors of the voice box, or even cancerous tumors of the voice box, you can have hoarseness that needs a further intervention. And really, if your voice is hoarse for more than 3 weeks, or there are other issues involved, as we show in our slide, that's the time to seek medical attention for it.
So what if somebody has difficulty swallowing?
Sure, difficulty swallowing is something that we can see a lot, and people describe it in different ways. Sometimes it's just a feeling of a lump in the throat. Sometimes it's actually a lot of trouble getting certain consistencies of food down, like liquids or solids. Other times it could be choking when trying to drink liquids or solids. And sometimes it could even lead to weight loss and malnutrition. So when we have these symptoms, including drooling and the other things mentioned, it can have several causes. It could be reflux. It could be a neurological problem. Sometimes diabetics will have a lot of trouble swallowing just based on progression of disease. And in certain circumstances, there can also be tumors or lumps within the esophagus or the mouth or airway causing this problem. And sometimes you could even have blood coming from the mouth with it, of course, another concerning sign. Basically, when you go to a specialist, they'll do an examination of swallowing either with a scope or other radiologic studies to really try and get to the cause of the swallowing difficulty and treat it accordingly, whether it be through medication, swallowing therapy, or if needed, certain surgical procedures. But the most important thing is to recognize the signs before they get severe and to seek attention for it.
Sometimes people get sores around their mouth. Sometimes it could be a little embarrassing, for the person. How do I know which is dangerous or which is harmful?
Sure. So we see a lot of different sores in the mouth, some of which are temporary and really nothing to worry about, and some of which are more concerning. On the more common side, we hear a lot about fever blisters, canker sores, which are not the same thing. A fever blister is kind of rounded with fluid inside it. I think we have a picture up to show. It usually lasts just a few days, and it's associated with being sick, having a cold or other infection. When you do have them, though, they are contagious. It's actually a virus, not a certain type of herpes virus that's causing it. So you are contagious while the sores are there, so you have to be careful with who you have contact with, even, sharing glasses and things like that. And it's usually treatable with just medicated ointment. Canker sores or aphthous ulcers look a little bit different. And again, I think we have a picture for those. You don't necessarily have to be sick. And again, they're usually temporary, coming and going. Also treatable with certain steroid-infused ointments made for the mouth. Things that are a little bit more concerning are things like thrush, which is a fungal infection within the mouth, and we worry about those in the extremes of age or people who are chronically ill or diabetic, and that again is usually treatable. We have other smoking-related sores, one of which is called leukoplakia or white patches, and then there's unfortunately tumors or cancers that can appear in the mouth, and they can be white, red, ulcers, and have other features to them. And really, if these things are occurring and they're not really going away or they're enlarging in size, it's important to seek medical attention and potentially get a biopsy for them.
You mentioned earlier about smoking.
Yes.
I want to touch over that, and you being, of course, an ENT specialist, I want to ask you, what effect does smoking have on someone's ears, nose, and throat?
Sure. We all know that smoking is, without a doubt, a risk factor for cancer within the head and neck region, and it's something that worsens the prognosis when you are diagnosed with it. So if you are diagnosed with any cancer and you keep smoking, that only makes your odds much worse. But besides cancer, there's a host of other things that smoking can do to the head and neck region that can cause a problem. It's basically chronic inflammation with congestion, bad breath. You can get voice changes and polyps and nodules on your voice box that are going to be troublesome to you. And it can give you reactive airway problems like asthma and decreased lung function and things like that. And it's not just smoking, cigarettes. If you use chewless tobacco or smoke a hookah pipe, there's misconceptions that hookah pipe is not really that harmful. Mm-hmm. It is. You're sitting in an area where you're having this smoke exposure without any filter for hours at a time. Wow. And it really is something troublesome. So you have to be worried about all forms of tobacco and secondhand smoke, not just smoking cigarettes.
Mm. So we all know this topic can be a little embarrassing, but what can someone do to control their snoring?
Sure. Snoring is another common problem we see in our office, and basically it happens when you sleep and the airflow going through the nose and throat becomes turbulent or blocked, and so it makes a funny sound. And it really depends on where the snoring is coming from, because it can come from multiple levels, all the way as high as the nose and all the way as far down as the sides of the throat going into towards the lungs. When you get an evaluation for snoring, basically we have to look at your anatomy and see where this blockage is coming from. Snoring in and of itself is not necessarily a medical risk, but if the snoring is associated with sleep apnea, where you're stopping breathing in between the snoring episodes, it really can affect your health. In adults, it's been linked to high blood pressure, car accidents, heart disease, and other problems. So if the snoring really is severe, it should be evaluated. In terms of treatment options for it, one of the tried and true treatments for sleep apnea is something called CPAP, or continuous positive airway pressure, where it's a machine that you sleep with that really eliminates the snoring, helps improve your breathing during sleep, and can help you feel better and more rested, because patients with sleep apnea often complain that they're tired all day long with headaches and things like that. There are surgical procedures that can be done to help open up the anatomy and help reduce snoring or eliminate it altogether, again, depending on where the area of anatomy is troubled. And there's also appliances or certain things you can wear at night to either pull the tongue forward or move the jaw a little bit in order to help eliminate the snoring.
So I want to touch maybe quickly and a little briefly on the topic of heartburn. Mm-hmm. What is a silent reflux?
So a lot of times when we think of acid reflux, we associate it in our minds with things like heartburn, burping, feeling uncomfortable after we eat something we shouldn't have, and things like that. But sometimes when the acid is not staying put in the stomach and it's coming up the esophagus, we can have reflux. And sometimes you don't necessarily have to have heartburn or that feeling of chest discomfort when the reflux is occurring. Sometimes it can present in other ways, like cough, throat clearing, hoarseness in your voice. Sometimes postnasal drip can be related to reflux and things like that without the heartburn and typical symptoms we think of, which is why it gets tricky sometimes to diagnose people because they're not having the usual symptoms of reflux and they're having the other symptoms like the voice or the throat clearing or feeling like there's a lump in their throat. A lot of times we can treat those problems easily with medication, and sometimes we do need help from our gastroenterologist colleagues or neurology colleagues to see why this is occurring despite, the typical medications we give.
Now, what are reasons why some people experience this dizziness or lightheadedness? What are reasons behind that?
Sure. So dizziness is a really common problem that an ENT can evaluate, but it's really a big black box of medicine because about 1,000 things can cause it. And when we talk about dizziness, there's ways to categorize it. You can feel lightheaded. You can feel motion sick when you're in a mobile place and you feel nauseated. Or you can have a sensation that you're moving or the room is moving. And, a lot of problems that can cause that. To keep your balance and to keep you from feeling dizzy, there's a lot of things that come into play. You're coordinating between the balance system in your ears, your central nervous system, your sensation when you're standing on the ground or touching things, to balance yourself. And then your cardiovascular system is also helping keep your blood pressure up and things like that. And when any of those things can go awry, you can have trouble. ENTs obviously see dizziness. That's most likely related to vertigo, which is when you feel you're moving or the room is moving, or that sense of imbalance or wobbliness. And there's a lot of things, again, that can cause, including problems with all of those systems we discussed. But in terms of the ears specifically, there's a few things that we typically see. One is called benign positional vertigo, which is treatable. There's a disease called Meniere's disease, where you'll get hours-long episode of dizziness, ringing, and sometimes fullness in the ear, and variants of those symptoms. You can have migraine headaches and have them associated with vertigo as well. And sometimes there are more serious things like neurological problems or things like that. So if your dizziness is not really just a transient thing that just went, or if this is something new for you that's not going away, and the like, you really should be checked out by a doctor to try and make sure it's not something concerning, and to have it treated as soon as possible.
So where can someone get more information on ears, nose, throat?
Sure.
Your whole topic in general.
No problem. There's a lot of great information available. If somebody does want to kind of do some research on their own, the American Academy of Otolaryngology and Head and Neck Surgery has a great website. It's www.entnet.org. They have a health information tab that you can click on and basically look up everything we talked about with much more detail.
Thank you so much, Doctor.
My pleasure.
Dr. Heidi. It was very informative.
Thank you.
Thanks so much.
My pleasure.
Thank you for joining us today on this episode of CYC MD. We hope we answered many of your questions in regards to ears, nose, throat. Please, if you have any question, feel free to email us anytime. We hope you join us next time at CYC. Until next time, God bless.